Hello, I am Mayor Kim Carr with the City of Huntington Beach, and I would like to welcome you tonight for another town hall that we call Candid Conversations about COVID. We've been doing these town halls since January, every Wednesday, first and third Wednesday of every month. And tonight I'm very, very excited because we have a jam-packed presentation for you with a lot of special guests. So thank you for joining us. We've got a lot of topics to cover, so I would like to, let's switch to the next slide. We have the latest updates on COVID-19. We're going to be talking about what the city's been doing as far as mobile vaccinations and the different programs that we have been doing here locally. And then the most important question, and the question that I get asked all the time, is how do I get the vaccine? We all know there are a bunch of different platforms, and so tonight we're going to talk about the different ways that you and your loved ones can get the vaccine. And then finally, we'll have an opportunity at the end to do a little Q&A. So please take advantage of the chat features on YouTube and Facebook. Type in your question. We do have people monitoring them, and we'll be asking them at the end of the night. After this video is done, we will upload it onto hbready.com/town hall. And we also have it on hbready.com/vaccine. So thank you so much again. I'm going to introduce our panelists for this evening. We have our illustrious city manager, Oliver Chi. Thank you so much for joining us tonight, Mr. Chi. Oliver has been instrumental in working with the county, with Orange County Healthcare Agency, and providing so many resources for our city to take advantage of the mobile vaccine, partnerships with Huntington Beach Hospital, Hoag, and now Ultimed. So we're really excited and grateful for Oliver's hard work on making all of this happen. We also have Director of Community and Library Services, Chris Slama. Thank you, Chris, for joining us. Chris has been instrumental in making sure that our underserving communities, our seniors, our individuals who may be limited with technology or language barriers, he's been fantastic with the outreach to making sure that those individuals get the vaccine. We also have our fire chief, Scott Haverly. Thank you so much. Scott has been on the COVID front from day one, and he has been helping us make sure that our community is safe. He's on the front line, so he has a wealth of information to provide us this evening. And then my final guest, I'm very grateful. I have Dr. Christine McLemore from Ultimed Health Services. Dr. McLemore is a board-certified family medicine physician here in Huntington Beach. She's been serving the diverse health needs of children and families for more than 10 years. She's a member of the American Academy of Family Physicians. Thank you so much, Dr. McLemore, for spending your evening with us to provide this information for our residents. We are very grateful. So as we've talked about in our first few series, our Candid Conversations, we've talked about the efficacy of the vaccines, we've talked about the development of the vaccine, but tonight we're going to talk about the latest information on COVID-19. So I'm going to turn it over now to talk with Mr. Chi, and you give us all the updates. As we know, the information changes daily. I personally subscribe to 4 different newspapers, and I'm constantly trying to stay on top of it, but it changes almost hourly. So if you could give us the latest updates on COVID-19 for here in Huntington Beach and here in Orange County.
Kim, thank you so much. And thank you for all the focus that you've wanted to make sure we're placing here at the city on COVID and the city's response to COVID. We really appreciated your leadership in directing the city's efforts as we kind of move through all of everything COVID related. And I think starting out tonight, I think the best place to begin is who's ready for COVID to be done? Oh my God, it's been what a year and a half we've all been through now. And I think the latest news, I think everyone, as you've been tracking the news, there's a lot of states that are lifting COVID related restrictions. I think all of us across the board, everyone's got COVID fatigue right now. And the data's been good. The last couple of weeks, we have seen The COVID trends continue to drop from our winter surge. The last couple of months, really post-Thanksgiving, we've been in this horrible spiral of COVID cases, tracking on top of COVID cases where it just was everywhere. The last couple of weeks, we've seen tremendously positive data, but as much as we're all ready for COVID to be done, I think the big takeaway right now is that the pandemic isn't yet over. We're making terrific progress. We're getting vaccines out. We'll talk a little bit tonight on how we're doing that, and we'll talk to Dr. McLemore about some of the programs that are getting rolled out through federal government interventions. It feels like right now we're 1,000 times better on the COVID front than we were a couple of weeks ago, and that's absolutely true. But as this chart shows, where we're leveling off right now across the country, and we're seeing the same trend here in Orange County, the levels that we're leveling off on really are somewhere around 70,000 cases, new cases a day. At that level, remember back to last summer when we had beach closures and it felt like our entire summer was restricted. We had to shut down the 4th of July because of COVID. The level we're at right now across the country is slightly higher than the level we were at back last summer. And again, as positive as the news has been, as positive as the current situation is compared with where we were during the heart of winter, the real takeaway right now is there's a lot of good news. The vaccines are starting to be more readily available, but now isn't the time to let down your guard. The pandemic is still here. I think we all know. Let's continue to try to stay safe, stay socially distanced, wear a mask, wash your hands. We're almost there. Let's all get over the finish line taking care of each other. If we go through the next couple of slides, just wanted to give the public a quick sense of the scale of what we're dealing with right now. Here in the U.S., we've by far had more cases of COVID than any other country, 28.7 million confirmed cases as of today. There's also been over 517,000 deaths from COVID here in our country. Just a tremendously horrible time the last year and a half that we've all been through. But again, there is a light at the end of the corner, around the corner, light at the end of the tunnel. We are getting there. In California specifically, and we'll work our way down to where we're at the county. In California, we've had nearly 3.5 million COVID cases. And we've passed that milestone. We've had over 50,000 confirmed deaths here in California. When you take that all into account, though, the good news is we've administered nearly 10 million vaccine doses here in the Golden State. Vaccinations are continuing to accelerate. And if you look at what's happening statewide, we go to the next slide. You may recall that the state had set up this phased tier reopening system, with purple being the most restricted tier. Now, if you looked at this map a week ago, it would have been basically all purple. What you're seeing now, though, is there are states where case rates and infection rates are dropping enough where we're starting to move into less restricted tiers. You see a little bit of red, you see a little bit of orange, and in the coming weeks, we're very hopeful that here in Orange County, we'll be moving into that less restrictive red tier. If we move into the next slide, in order to move through the tiers, I think everyone's been hearing a lot about the metrics that the state uses. Really, there's 3 key metrics the state's tracking as it relates to whether or not you move into these less restricted tiers. Those would be the adjusted daily case rate, the testing positivity rate, and also the health equity rate. And currently here in Orange County, these are our numbers as of today. The adjusted daily case rate, that's the number of new cases for every 100,000 people in Orange County. That number is currently at 7.6. This puts us into the purple, most restricted purple tier. The good news is, though, that our testing positivity rate and our health equity testing positivity rate, that would be the percentage of tests returned that are positive for COVID for the entire county and also for our most underserved communities. Both of those numbers have dropped dramatically the last few weeks, and they're in the orange tier, which is a much less restricted tier. So that's a good thing. The scaling, though, that we wanted to make sure that everyone understood is that we're trending in a positive direction. that when you look at those three metrics, Orange County is really close to being able to move into the red tier status, which is the less restrictive status. And really what that means is that there's less cases of COVID happening and there's less transmission of COVID happening. And that's a really, really good thing. But you remember at the start of the discussion, we said that our case rates are leveling out. What we've seen here in Orange County is that our testing positivity rate has dropped pretty dramatically and pretty consistently over the last month. Our daily case rate, though, the number of confirmed positive cases on average every day, that number is stalled out and plateaued at about 7 new cases for every 100,000 people here in Orange County. That's reflective of the nationwide trend where the cases aren't decelerating to 0. And that means as COVID is still here, we still do need to take everything positively or take COVID seriously, even though we are trending in a positive direction. And really, what everyone should take away with all this good news, if we flip to the next slide, the bottom line is that within the next week, we should be able here in Orange County to move into the red tier if we're all continuing to stay safe and socially distanced. And as we move into the red tier, if our numbers hold, the way the state works, again, it's been super complicated, all of the state regulations. Once you hit the numbers, you have to hold your numbers for 14 days to move into that next tier. So assuming next week our numbers move into the red tier status, 2 weeks after that, we'll be able to transition into that less restricted tier. And when that happens, if you go to the next slide now, when that happens, a couple of things will shift in Orange County. The most noticeable will be restaurants will be allowed to serve indoors again at 25% capacity, which I know we're all anxious and looking forward to doing. Malls and retail stores will be able to reopen at 50% capacity. Currently, those are only at 25% capacity for any of the retail options that we do have in Orange County. On the gym front, I know folks are trying to get back and get their workout routines going again. Once you move to the red tier, gyms will be allowed to reopen in Orange County at 10% capacity. Movies, theaters, museums, and zoos, those will be allowed to be reopened again indoors at 25% capacity. That's all going to happen here, likely within the next 3 weeks. So a lot of positive news on the overall COVID front, all of which is going to be made more positive, Tim, with the vaccination process that we're seeing. And that's really ramping up. And I know you're really engaged in that conversation.
Well, thank you, Oliver, for that comprehensive overview of where we are right now and where we hope to be going in the next 3 weeks. I know a lot of people, especially me, are looking forward to getting back into the gym and losing that COVID-15. So next, I'm very grateful to have Chief Haverly join us to talk a little bit about the vaccines and the different types of vaccines that are now available. I know everybody's heard all about J&J coming online and a lot of different confusion between the Moderna vaccine, the Pfizer vaccine, the J&J vaccine, and even questions about is one better than the other. So Chief, walk us through this, and if you would shed a little light on the efficacy of the different vaccines and what we should be looking out for.
Great, thank you, Mayor. I appreciate the introduction and the time to be able to speak to everybody tonight. So on the PowerPoint slide, you'll see that there's 3 vaccine options in the United States. And so the one that we're most familiar with is the Moderna and Pfizer, because they've been out the most and probably the most recent since December. Now, the thing to note is that all 3 of the vaccines that are out are 100% effective at preventing hospitalization and death due to COVID. And I think that's really important for people to understand, because a lot of times when they talk about what's the efficiency or the efficacy rate, if it's at 94% versus one that's 65% or 66%, which one should I get? But the reality is all 3 of them are 100% effective at preventing hospitalization and death. And that's what the studies have shown. Moving forward with that. And I think that's really important for people to grasp onto, because a lot of times we get questions for which one I should get. And what we tell people, when you're offered the vaccine or whoever's providing the vaccine, any one of the 3 are great. You're not literally looking to shop around. There's not a best vaccine of the 3. Any 3 that you're offered are good. We encourage anyone to take advantage of that when that happens. When you look at RNA technology, it's very new. It's something different for us. than when you have in the annual flu shot, where you have, in essence, the dead virus is injected. This isn't a dead virus, and mRNA is in essence really a way that the shot will teach our immune system, or teaches your immune system, on how to recognize and fight the virus. And that's really the simple fact of what it does. It's an engineered dose. And so what's important to remember that if you get a Moderna, you need, for your first dose, you need to get it for the second dose. And so Moderna's 28 days in between. Now, also, people get really concerned about, well, they canceled my appointment. It's going to be 29 days after. It's okay. You can go past the 28 days. You don't want to go earlier than 28, but you can go past it and it's okay. You don't have to worry about that. We do get a lot of calls about, well, my appointment's it's 30 days or 31 days. That's okay. And that's not a problem, and it's not going to change the effectiveness of the dose or the virus. And Pfizer is at 21 days apart, so it's a little quicker than the other. Now the Johnson & Johnson's a little different because it's only one dose, and so you only need to get one going through that process, and you don't need to come back. That's an exciting because you get more people doses quicker. Over 3 million have been sent out, and I believe coming to California over the next week or so, and we're going to see those starting to increase in the market, and you're going to start seeing those coming up on a lot of different avenues. We really want to focus on this is just to let people know that if you get offered any one of the three, they're all great, they're all revolutionary. The level of efficacy is incredible. The flu shot averages 40 to 60%, depending on the flu shot. These are very high and they're very good. So on the next slide, we'll talk a little about the vaccine availability and how the supplies are changing. And so what's really great is it was announced I believe just yesterday by the president that everybody in the United States, every adult, in the United States that wants a vaccine will be able to receive it by the end of May. And that's pretty incredible. It was in July, and we've set it up to the end of May. They're really spreading out the system of where you can go. Like Ultimate's on here tonight, and they're a company that provides vaccines, CVS. The counties are having super pods. So what happened in the beginning is that the vaccine came out very fast. We reacted and developed these sites to be able to give the vaccine and distribute it as quickly as we could. And now the system to develop the vaccine has become so efficient that we're outpacing the vaccine and we're having more shortages. But I think they fixed that at the federal level. They made some incredible deals and contacts and to get them produced and moving a lot faster. And we're going to see a really increased movement of vaccines coming out in the next month, so be prepared for that. Currently, we're still working on phase 1, which is greater than 65 and critical healthcare workers. We've gotten through a tremendous amount of that. And really to talk about how effective this has been in the country, in skilled nursing facilities, there's been an 82% drop in COVID infections. And that is like mind-boggling how incredible that is. That means before this was running quite frankly rampant through that community, and it was resulting in significant level of death and sickness. And so to have an 82% drop after the vaccinations have been coming out with prioritizing 65 and older, it shows how effective these vaccines are. We're also in phase 1B, or the tier 1 of phase 1B, which is for education, food service, grocery, agricultural, childcare providers, and emergency services. And they're putting aside about 30% of the vaccines for phase 1B now. We still want to get the healthcare workers and over 65 a priority right now. Eventually, that'll move into the phase 1B. And I would expect as the vaccines come and the process of it moving, we're going to see that move really fast in the next few weeks. So a little bit more facts about the vaccine on the next slide that talks about, we talked about before, it's more effective than the flu vaccine. The flu is an attenuated virus or a dead virus that they inject in there. This is very different, as we talked about. The mRNA is in essence a way to teach your immune system. It's revolutionary, it's incredibly effective, and it's much different than the flu. All three are safe. They went through rigorous FDA testing. I mean, rigorous with a large case of over 120,000 people that were tested and tracked. And I think what is truly exciting about this vaccine is that we're not having people with the vaccine. We're not seeing people that are going to the hospital or dying from the virus. And I think you might still get sick with it, a very small percentage, but it's going to be like a common cold or a cold process. You know what? We'll take the cold over the effects of COVID. The effects of COVID are quite devastating for people. Also, when they talk about the COVID-19, you won't test positive if you get the vaccine. That's not how it works. And a lot of people have also asked questions about, what if I've had COVID-19? Should I still be vaccinated? And 100% yes, you should still do that. The CDC strongly recommends that. If you had, depending on the treatment you took, and you have to talk to your doctor, but if you did get a blood transfusion or you got some more significant treatment with COVID, you could wait up to 90 days. But typically, if you had COVID and recovered, you still want to get the vaccine through the process, but it won't make you test positive for COVID. Additionally, this vaccine doesn't enter the nucleus of your cell, which is where your DNA is located, so it doesn't affect your DNA or alter your DNA. Remember, it's a roadmap that teaches your body how to fight that spike protein that is COVID. A little more facts about vaccines on the next slide is that you will have some side effects. So because as a first responder, I received my COVID vaccination. The first shot itself, you will have some arm pain for sure, and it'll be a little bit sore and it'll last a day or so. I would say it's very similar to like a tetanus shot. When you get your tetanus shot about once every 5 years, that kind of feeling of a tetanus shot on the first dose. The first dose, many of the people that we had and many of the firefighters and first responders that we talked to just had arm pain, which was one of those things where you may last for a day or so. You have that. On the second shot, more people had what I consider really minor side effects, and those can be you're still going to have some arm pain. And usually we saw, and this is anecdotally, it's not empirical study, but we saw typically with our people about 10 hours after the second shot, you had some, maybe you're a little tired. Some people was tired and you wanted to go to sleep, take a nap. I told that to Oliver. I said, hey, I got the second shot. He said, how you doing? I'm like, good. But I said, honestly, I feel like I want to take a nap right now. I got about 5 or 6 hours now. And that lasted for, honestly, lasted for 24 to 36 hours. After the 10 or so hours, you might have a low-grade fever. You might have, some people had a little bit of the chill. Some people maybe felt a little tired, maybe more tired. And so when we try to tell people it's body aches that can come with it, and when we tell people this is okay, this is actually a good thing. This is your body kind of basically building the protection mechanism to help you if you get exposed to the virus. So it's not a bad thing to do that. You can tell your doctor if you would like to take Advil or Tylenol to minimize some of the symptoms, and that'll be up to you to decide that with your doctor. But ultimately, these kind of side effects are very normal, and we like to communicate that to people so people don't feel like that what they're having is they're getting COVID from this. It's just a minor side effect as your body builds the immunity. I will tell you, the next day for me, it was a great excuse. I say excuse to sit down and watch golf on the couch for like 12 hours. So that was really cool. And, I told my wife that I had the COVID shot. I'm gonna and so I did get the shot on a Friday. So that way over the weekend, I could have time to recover. So I would just plan your schedule when you get the second shot. But it isn't debilitating by any means. It affects everyone a little bit different. I also would tell you that, I encourage my parents, they're both over 75. They live in a state. They both got their COVID shot. For them, it was about just being tired. My dad did watch golf as well. He used that. That's why I told him what I did with golf. He did the same thing, watched golf all day. And then my mom she said, I just took a lot of naps is what it was for her. And so I'm really in favor of this. I'm excited about what it can bring to our community and the health. And so I've encouraged my family, our staff, our firefighters, myself, command staff to all get the shot. There is no scientific evidence about infertility. That's something that's been out in the news a lot, but there isn't any scientific evidence to that, and especially with the CDC. It is not mandated by the government that you get the shot. It is your personal choice to do that. I think for us, why we have these tonight and what the motivation to do this is we just want you to be informed and to be truly informed so you make a good informed decision on whether or not you get the shot or not. And also the vaccines are provided at no charge at this time. So when you want to know how you're eligible, and sometimes that can be kind of confusing and frustrating a little bit. If you go to covidvaccinefacts.com, you can put in your information and determine your eligibility. We really want to encourage you to go to the Athena app to still focus on that, especially in Orange County. That is the app to do that. You can call county's COVID hotline, which is up on the PowerPoint, but it's 714-834-2000. You can call that for information as well. But on the Athena app, it will walk you through asking you different questions, and it'll help put you into the location where you're at. It's really important that you continue to use that app. Even if you get one at CVS or Ultimate, and you have a schedule, keep it in the app, go through that process. And I know some people have expressed some frustrations with using it. In the beginning, it did shut down, and they would close it down here and there because we had an overwhelming response. I think they had something like 500 million hits in one day when they opened it up. It was pretty incredible for how well it was used and processed. So be patient with that. The idea is keep your appointment, make sure that you attend when your appointment's going to go, but still go around and still work to find it at other locations if you can. We would always really encourage that. And I think I would turn it back over to the mayor to discuss our mobile vaccination program.
Yes, thank you so much, Chief, and thank you so much for all of that information and updates on the vaccines and the efficacy and your own personal story with getting the vaccine. You know, my mom got the vaccine and had similar results as you did, and from friends that I know that have gotten it have mentioned similar situations where they really felt tired after the second shot. So we're going to talk a little bit about the chief mentioned all of the different ways that you can find out if you're eligible and sign up. But for some people, they don't have access to Wi-Fi, or there may be language barriers, or they're homebound. And so I really, at this point, I'm going to turn it over to Chris Lama to talk a little bit about how the city was able to identify those individuals and how we were able to reach out to them to get their vaccines as well. So Chris, if you would talk a little bit about all the efforts that you did for our senior community as well as our underserved community that may have had some language barriers or some technology barriers, or maybe even transportation barriers. You know, we have a lot of people that are 80, 90, and even 100 that don't drive. And so they have no way to get to a super pod site in Anaheim. So Chris, if you wouldn't spend a few minutes talking to you about how the city coordinated this outreach effort so that we could do mobile vaccine sites here in Huntington Beach.
Absolutely. Thanks, Mayor Carr. So fortunately, pre-COVID pandemic, we've had excellent partnerships around the community, supporting our seniors throughout the city, as well as our Latinx community, specifically down in the OQ neighborhood. So we had some excellent opportunities to partner up with some of those to provide some vaccinations at mobile sites, also partnering with the hospitals. But before I get into to detail on those particular sites, if you don't mind, I think I'd like to kick it back to Chief Haverly to talk a little bit about the initial pod that was set up at the Central Net facility at the Huntington Beach Fire Station.
Yeah, thank you. So in the beginning of this, when the vaccines were initially rolled out, Orange County Health asked the fire service in a couple different locations to help bridge the gap between when the super pods are going to get set up to start vaccinating healthcare workers. So the hospitals were doing that, and then for fire, police, they asked us to help kind of bridge that. So we started to do that at our locations. One is called Central Net. That's on Gothard at one of our fire stations. It's our training facility. And so our staff working that, Chief Lopez was the head of that, and we went through a training process where we trained people to vaccinate and to run through the entire process working with the county. We did it in conjunction with Newport Beach, with Laguna, Fountain Valley, Costa Mesa, and us worked together at a Central Net. And we vaccinated over 11,000 people out of that site. The majority of the people at that site were vaccinated were over 65 that went through the Athena app. We also did first responders, police, firefighters from all those 4 or 5 cities around Central Net, kind of working together in conjunction with, working with community services, public works, and PD. It was really a great 1HP moment of us working together to vaccinate as many Huntington Beach residents as possible in that time frame. And what was really exciting about it is not only were firefighters vaccinating, but lifeguards were doing that. We trained a number of our lifeguards to process vaccines, and you'll see right on there, you have a firefighter, and Leslie, one of our marine safety officers, is getting vaccinated. Now she's one of the people who are doing the vaccinations. And I said, our lifeguards have been really instrumental in helping to assist and staffing those pods. So this was really a process to bridge between the two, but we did over 11,000 together. And that was something I'm really grateful for, some great work.
Seniors. So if you could talk a little bit about how that all came about. Oh no.
I apologize. So as that was all going on at Central Net, we were ensuing with conversations with our partners out in the community, as well as a couple of the local hospitals, Huntington Beach Hospital and Hoag Hospital. And so with a very short notice, we were very fortunate to get a call first from Huntington Beach Hospital, from Hoag Hospital, that they had 300 vaccination doses available. and asked us if we could, find people that would be able to, we'd be able to set appointments to receive those. So between our senior center staff and volunteers and our partners in the Oakview community and the Children's Bureau, the school district, the fire department, the police department, we started reaching out to a lot of our existing clientele, those families that we knew had the 65 plus age people that needed the vaccination. As you mentioned, Mayor Carr, some not having the greatest access to whether that's technology or transportation. So as many people know, and many people don't know, we have a free transportation program for seniors in Huntington Beach over 60. So in coordination with our seniors team and our volunteers, and of course the partnership with the hospital, we were able to schedule in just a couple of days notice, really, we scrambled and we scheduled the initial 300 people that got vaccinated. About half of those were from the Oakview community, the 65 and over. The other half were actually an existing list of clientele that we serve really throughout the year through the Senior Center in Central Park. These are our homebound, our frail and elderly that are trying to continue to remain independent at home, which we try to facilitate as best we can. So we started with that list knowing that they were the most in need, most of them lower income. And it was just, as Chief Haverly mentioned, a great 1HB moment to get them out there. They've all 300 of those have had their second dose. The other partnership, as I mentioned, was Huntington Beach Hospital shortly after reached out, letting us know they had enough to vaccinate 600 residents. And so then, we scrambled again. We looked at our list. Concurrently, we had been taking an interest list at the Senior Center. We have a lot of people calling daily, normally have 500 plus visits at that Senior Center. So a lot of contact, and we anticipated this might happen. So we had been keeping a list of those that would be eligible for the vaccination. So ultimately, we ended up with a list of about 1,500 people that were interested in the vaccination. We were able to contact 600 of those. And since then, so between those two, we've had a total of about 970 eligible seniors that have been able to have access to vaccination appointments. So really great partnerships to be able to facilitate those, and really a kudos to the team and the partnerships out there for the assistance with that. And aside from COVID, we do have a lot of senior services in particular, not only for those that are actively aging that come to the Senior Center, but those that are homebound. So you see an information line there at the bottom on that business card, 714-536-5600. So that's a general line that you can call for any, if you're a senior, if you have a family member that is, or a neighbor, and you sense they're in need of services such as meals, transportation, even visits from volunteers, just check-ins, trips to the grocery store, doctor's appointments. Those are all free services for seniors here in Huntington Beach. These are things that we do year-round, and we're very proud to do it. We consider ourselves a great place to age here in Huntington Beach. During this time of COVID, we've delivered, the team has delivered over 90,000 meals to homebound residents in Huntington Beach. And that's also in partnership with Orange County Meals on Wheels that we appreciate greatly. We're able to get those meals at no cost, and our staff and our volunteers get those out to homebound seniors. Aside from that, again, a free transportation program for anybody that's 60 or over and lives in Huntington Beach. If you need a ride, again, to an appointment or shopping, whether that's a hair appointment, nails, doctor, anything within the city, you can get a ride there for free. Just call that number that you see on your screen. And then again, a lot of care management services, information and referral to homebound seniors. So with that, yeah, just please take note of that line. I would also like to say, if just a reminder, if you're interested in getting on that list, should we have the opportunity to schedule you an appointment for the vaccination, call that number. We'll get you on that interest list. But we always like to remind you, if you already have an appointment through Athena or any other organization to get the vaccination, please keep that. That's still the primary means. We're just trying to be proactive to have a list ready should we have those opportunities to schedule vaccinations.
Thank you, Chris, and thank you so much for all that you're doing to help our seniors and our underserved community. And Huntington Beach truly is an age-friendly city, and we have a lot of programs available for our seniors, and please take advantage of those opportunities. So now as we move on, a lot of people are like, well, how do I get a vaccine? I mean, the vaccines are here, but if you're somebody like me, you're still waiting and you're wondering, when is my group going to open up? So They are here and they will prevent you from getting sick with the COVID-19, as Chief Haverly illustrated and talked about how it's 100% effective, and you will not go to the hospital. So that's fantastic. But if you're like me and you're still waiting, it's still really important to practice the 3 W's, which we say: wash your hands, watch your distance, and wear a mask. So when can you find out when it's your turn? So Mr. Chi, I know that you sit on the vaccine task force for the County of Orange, and you've been up to date on all the different types and ways that you can get the vaccine. Can you walk us through what are the different options available?
Vaccine has been like for a lot of people. What do you do? How do you get it? What is this Athena app? I heard that Blue Shield's in charge now. What does that mean? Wait, Ultimed has vaccines? What's happening? So we're going to try to provide a little bit of clarity. It is super confusing right now based on all of the different mechanisms, and we have been working here at the city, and Mayor Carr, thank you for the push to try to articulate more clearly, how do we get vaccinated? Because there are so many different ways now. The primary way to get vaccinated, if we go to the next slide, is really going to be right now currently through the Orange County SuperPod. So there are a couple of different larger scale pods that the county has set up through SoFA University, through Santa Ana College, at Disneyland, and at the Anaheim Convention Center. Typically, that's how most people will be accessing the vaccine currently. And you can register at athena.com in order to get into the queue for when it's time to get your vaccine. But that's only one of multiple ways of getting the vaccine. This is the most typical way that it'll happen. And on the next slide, we'll talk a little bit about when you do go to the SuperPod, that particular process, they're at larger sites. Typically, if you arrive there no more than 20 minutes before your appointment, and within an hour or so, you'll have gotten your vaccine and you'll have gotten monitored for any types of potential reactions to the vaccine to make sure that it's safe. Again, this is one of the primary ways to get it, but right now, if we go to the next slide, as the vaccine has become more widely available now, and as the federal government has, in the last couple of months, made tremendous inroads in starting to distribute the vaccine through more different channels and making sure that folks have different ways to access where the vaccine actually comes from. There's actually multiple ways now to get that vaccination shot. Again, the Athena app that we talked about, the Athena website, is one way to do that. The state of California, though, has also now tried to, and if we go back one more slide, we'll get into the Athena app in one sec. The state has also gotten into the distribution process. The state recently brought on board Blue Shield, California, to act as the distributor of the vaccine in order to address equity issues and to try to speed up and simplify the process and standardize it really across the state. So a secondary system that you can register on right now is called My Turn, and we'll run through that here in just 1 second. So those are the sort of government access routes that you do have. In addition to that, there's other ways. If you are part of a medical system that is if you're part of a larger medical system, there are direct vaccine doses going to those systems also. So here in Orange County, UCI Health, Providence, Memorial Care, Cove, and Kaiser are all direct distribution points for the vaccine. If that's one of where you go to get medical care, you can get access to the vaccine through those medical systems by talking to your primary care physician. And then the final way that's happened, the federal government has signed contracts with 29 different pharmacies, national pharmacies that operate across the country on different various websites. If you go to Rite Aid, CVS, Pavilion, Walgreens, Albertsons, you'll be able to access the vaccine in multiple different ways through online registration appointment systems that those pharmacies have set up. Now, all of this information is available on the city's one-stop COVID response website. That website is htready.com. If you go to that site, there's going to be a vaccine link, and you click on that link. We've preloaded all of the links to all of these different locations so that you can more quickly access the vaccine and sign up through all the different avenues where it is available. But before we talk about another cool option, and actually Mayor Carr is the individual who brought this program forward. The county and the federal government have been all working on distributing the vaccine. Mayor Carr, I think you were on a call a couple of weeks ago with the county officials when they mentioned there's this cool program that's being developed with Ultimate to accelerate distribution. And you'd like to talk a little bit about that and then introduce our friends from Ultimate and talk a little bit about this new program that's been developed.
Well, yes, I was on the call. The Orange County Healthcare Agency does a call every Friday for mayors announcing different programs that are happening and the latest information. And on one of the calls, they announced that the federal government is doing a partnership with Ultimate. And Ultimate has been a great partner here in the city of Huntington Beach for years. And so the minute that I heard that, my ears perked up and I thought, Oliver, you have to call Ultimate immediately and see if there's a way that we can partner with this medical group and reach out to some of our most vulnerable residents here in Huntington Beach. So kudos to Oliver. He got the ball rolling. And the next thing we knew, we were in talks with Ultimate. And so I'm going to just sort of skip ahead a little bit here because I want to give Dr. Christine McLemore some opportunities to talk about her program and what she's been doing and really about the partnership here with the city. So if we can just fast forward a couple of slides here so that we can bring Dr. McLemore in to talk about Ultimate and the vaccine sites and what they have planned. So thank you so much, Dr. McLemore, for being a part of tonight's presentation. And again, thank you so much for everything that you've been doing for residents here in Huntington Beach.
To be with everyone tonight. I want to just kind of reiterate some of the things that have already been said tonight. There is no best vaccine. The best vaccine is the one you can get right away and the fastest. And as Oliver mentioned, it is confusing to try to figure out where to get that vaccine. And I encourage a lot of our patients sign up on multiple different sites. Go look for it everywhere and keep looking for it. And as soon as you get an appointment, go get it. And really, Ultimate, as the mayor mentioned, we're now one of those ways you can get the vaccine. So in Orange County, LA County, we are getting doses from the federal government and giving it to those folks who are in tier A and B. It was mentioned this evening, those are healthcare workers, childcare, educators, grocery. So if you are eligible, you can call Ultimate, and you can see our phone number right there on that slide. That's a special phone number you can call to get an appointment with us to get a vaccine. The vaccine you will get is the vaccine we have on hand. So sometimes we get Moderna, sometimes we get Pfizer. We've yet to get the Johnson & Johnson, but I'm sure that will be coming as well. So again, I encourage you, don't worry about which one, just worry about how quick can I get it. But we're happy to help vaccinate the city of Huntington Beach. It's one of actually the happiest things I'm doing in the last year. After everything we've been through in the last year, I remember the very first day being able to give one to a patient and went home and said, that was the best day ever, because I feel like we're starting to get some hope in this rough year we've had.
And I have heard that at these vaccination sites, it's joyful. People are very positive. They're excited to get their vaccines because it is the light at the end of the tunnel that we all realize this has been a very, very hard year for so many of us, and we've lost loved ones, and it has affected more people harder than others. And it's been a dark time for a lot of people, and these vaccination sites are a ray of hope and people are excited to be there. The workers are excited to be there. The doctors are excited to be there because it really is everybody coming together. So, and I appreciate that Ultimed has a phone way to register, because one of the things that I hear about, and this actually came up over the weekend when I was talking to my sister-in-law, is I said, well, have you gotten your vaccine yet? And she said, well, I don't have a computer. She doesn't use computers. So having that phone option is really critical for our senior citizens and people who may not have access to Wi-Fi. So I did have a question about that, the phone line though. Are there certain times when people can call, or is it a 24-hour line, or is it an 8 to 5?
That's a great question. I want to say it's similar to our call center, which is, I believe, a 7 to 7. I'm not sure, but I believe that's what it is.
So to play it safe, call 7 to 7.
Yeah, let's say that. But I will echo too with the senior citizens. My grandma is in her 80s, and we had to help her do the Athena app, and it took us 3 hours. We asked her for her email address, and she started just creating one. Let's see. I said, Grandma, is that your email? No, but can we just use it? No, Grandma, no. So I agree. The phone number is a great option. And we're just so thrilled at Ultimed to be able to provide this for our city.
And thank you so much again for all that you're doing for the residents of Huntington Beach. So now is our favorite time of the segment where we get to do a little Q&A, and I've got lots of questions for tonight. So we have a lot of people watching online via Facebook or YouTube. And so I'm going to throw it out there, and whoever wants to answer the question, just go ahead and raise your hand, or you can start talking. And this again talks about to the efficacy and the safety of the vaccines. Have they been FDA approved? If somebody wants to take that question.
I can start, and then maybe everyone else can jump in. But the vaccines have all received what's called emergency use authorization, or EUA authorization, through the federal government. What that means is they've gone through all of the initial rigorous trials that are required for any type of drug approval. Here in the U.S., we have the gold standard of what it takes to get vaccines approved. And so it has gone through all of the preliminary assessments and trials that all vaccines have to go through before they are authorized. They haven't completed all of the durational studies to gain full approval, though. Based on all of the approvals that have happened to date, the EUA approvals, within the next couple of months, when we move through COVID, the FDA does expect and anticipate to give their final approval for the drugs. But given the COVID pandemic right now and the speed at which we've gotten everything developed, all of the vaccines have been approved on EUA access, which means they've been tested and they're safe. And now they have to do the long-term monitoring before you get the final stamp of approval.
No, thank you. Dr. McLemore or Chief Haberly, did either one of you want to add to Oliver's explanation on FDA approval?
No, I think I basically 100% agree. It's exactly the process. It's very normal that when they get the emergency use authorization, it's a normal process. The vaccine moves out, especially in emergency, and then it gets the final approval at the end.
Great. So my next question is, where can someone find out, is there a list somewhere that explains what's an essential worker? And I know that term's been thrown around a lot. And is there some place that I can find out what is an essential worker? Is there a list somewhere? Dr. McLemore?
Sure. The best way, honestly, is to look at those tiers. The tier 1A, the tier 1B, and it starts to kind of go into what is an essential worker, and it talks about healthcare, emergency workers, groceries, school education. But that list that California puts out with the tiers is probably the easiest way to go figure out if you qualify in one of those tiers.
Okay, great. Now, another question that we get a lot, and I've heard this on social media, that once I get the vaccine, it's anything goes. Do I still need to take precautions if I get the vaccine because I'm not going to get sick or whatever? What's the recommendation after you get the vaccine? Go ahead, Dr. McAvoy.
I was going to say, I was like dying to answer this one.
Go ahead.
I think what people really have to understand, so when we say it's 95% effective, there's a 5% chance, right, that you could get the virus, but you may not notice it as much because it's going to be super mild, right? So I might have little sniffles or I might not feel quite good. You probably wouldn't even know that you had it. And so we've not really confirmed yet, can we transmit it to other people once we've been vaccinated? And even though that risk is really low, we're really recommending that people continue to wear a mask and socially distance and don't gather. And I know we're all so anxious to go back to life as normal, but there still is a risk that you potentially could spread it to someone else. So it's not so much anymore about you not getting sick because you have that comfort of, I'm not going to the hospital, I'm not going to die from COVID, which is fabulous. But you could potentially give it to someone else. And so we really have to hold tight to those guidelines until more of us are vaccinated.
Right. No, and once more people get vaccinated, then I'm sure we'll go back to not having to wear masks and everything. Yeah. But we've heard a lot, speaking of masks, a lot of wearing double masks. And Doctor, can you speak to a little bit about double masks, and is that essential?
I'm going to give you my personal opinion.
Okay.
This is my I think it's hard enough to get everybody to wear one mask.
I agree.
Less two. So if you will just wear one quality mask around your nose and mouth, I'm thrilled. Because we often see them like this and like this, and so just one good quality mask is wonderful and effective.
Right. Well, thank you. And I agree. It's hard enough to get people to wear a mask, and I think if we could get everybody to wear one quality mask, we'll take it. And if you can wear two, more power to you. But if we can get one, even better. Okay, I'm going to go down my list of questions here. What if I have trouble registering for the Othena app? Is there a number, or is there a way? Oliver, can you speak to a little bit about if somebody's having trouble registering on the Othena app, what's the best option for them?
Yeah, no, absolutely. There have been folks who have had trouble registering on Othena, and initially the county had set up a telephone number that folks could call. It wasn't working great. So if you're having trouble, give me 2 seconds, I'm going to pull it up. There's a website here in Orange County that we've all been referring to. That website is www.covidvaccinefacts.com, and that's covidvaccinefacts.com. And when you do go to that website, you're going to have a variety of different information, including the most up-to-date county telephone number that you can call for assistance in registering. On the Othena app, also on the Othena website, it has a little bit of information. But if you go to www.covidvaccinefacts.com, it's the county's clearinghouse and repository for all information for any type of assistance you need with COVID.
And we should point out too that for those that might have technological difficulties with their computer, that there is a telephone number that they can call, which is 714-834-2000. Again, 714-834-2000. If you're having some technical difficulties with Othena, or just if you have a question in general about how to get the vaccine or what should I do, call that number. That's sort of a catch-all number that will be able to point you in the right direction. Here's a question that I'm going to throw it out to anybody who might know. Does anybody know if there will be super pod drive-throughs, especially for disabled residents? Does anybody know if there will be any kind of drive-through super pod?
No, absolutely. And I think Scott and I can probably both answer this, but this week, the Superpod at Disneyland is actually being shut down for modifications. And those modifications that are being made are going to facilitate better ADA access for individuals who have access concerns or access issues. The Disneyland pod should be back up and running later this week on Friday after all the modifications are up and running. But that will be the pod site that folks with ADA issues are going to be directed to, where you'll be able to view the drive-through related access. Scott, I'm not sure if you heard anything different at this point.
No, SoCa has a drive-through for ADA as well that's set up, but Disneyland did shut down part of this week to develop that. They're going to dry run the drive-through on Sunday and then open up officially on Monday at Disneyland for ADA access.
Well, that's great. And do you guys know if the super pods still need volunteers? I know there was a call for volunteers a few weeks ago. Are they still looking for help? Oliver?
No, absolutely. The county has a list of folks who have signed up to volunteer. At this point, my understanding is that there's not additional volunteers that they do need to operate the sites, but they are continuing to pull and maintain that volunteer site listing. There's challenges that the county ran into. There were folks who were interested in volunteering to provide access or actually give the vaccine doses. But in order to qualify folks, they had to run through all of the different background checks. There is a website the county has set up for anyone interested in volunteering to help. And if you do sign up there, the county will vet everything. And if there's a need, we'll call you back. I'm going to pull up that information right now, Kim, and I'll get that out to everyone in just a minute.
Okay.
If there are other questions, Kim, while I look that up, maybe we can.
Okay. I was just going to really just kind of wrap it up a little bit at this point. You know, I really want to encourage everybody to go on hbready.com. As Oliver said, you know, we have /vaccines. We have a catch-all where you can have access to all of those links have been embedded so that a lot of people have questions. Well, there's CVS, there's Rite Aid, now there's Ultimed, Hoag. What do I do? And I think Dr. McLemore, you said it best, sign up for them all.
Mm-hmm.
Just sign up for everything and then take the first one that you can get. And I think that really, for me, that really kind of sums up what you should do is there's a lot of different options. And so there isn't one central point right now. So sign up for all of them and then take the first one that you get. So if you're confused as to, well, I want to look up CVS or I need to look up Walgreens, just go to our website, hbready.com/vaccine, and you'll see all of the listings of all the different ways that you can get the vaccine. Click on that and you'll be able to sign up. And then also, I just want to let anybody know if they weren't able to catch this or if they want their friends to watch it later, because there was a lot of great information tonight. You can always look on hbready.com/town hall. That's where we upload all of these. They're available on YouTube and you can watch them at your leisure. So again, those two critical websites, hbready.com town hall, hbready.com vaccine. Those two options will point you in the right direction. And I really want to thank Dr. McLemore for sharing some time with us this evening and letting us know how Ultimed can be a part of the solution and everything that, again, that you're doing for our community. And thank you, Chief. Thank you, Chris. And thank you, Oliver, for sharing this information with our residents. It changes all the time, and I think that these town halls have been a great way to keep our residents updated on the latest information regarding COVID and how to get the vaccine. So until you get your vaccine, please practice the 3 W's of wear a mask, watch your distance, and wash your hands. So thank you so much, everybody. Have a good evening and be safe.